Hello everyone, welcome to this video. I posted a video I think 2 days back about vaccines and that was about what vaccines are available, how the rollout is working, how long will it take to reach the herd immunity for all of us and be back to normal our lives. Several variants have been identified. How is it affecting the effectiveness of the vaccine, cost of vaccine, etc. etc. Those who have subscribed to the YouTube may have already seen it. Those who have not may perhaps go to the channel that I've got on the YouTube, and if they're interested, get subscribed to it as well. Today we will talk about vitamin D, which is a relevant subject for COVID. I'm a student of history, and I always have wondered that we have been on this planet for mankind has been on this planet for almost for thousands of years. But in the last 200-300 years, we have really made big strides of about particularly in medicine and many other subjects. Um, Talking about medicine and vitamin, the first ever vitamin A, was found in 1913, and vitamin D was identified in 1932. Vitamin D is really, for all practical purposes, by the definition, it is a hormone also, not only a vitamin, because it is produced in our bodies. Sunlight contains ultraviolet rays, and the UVB part converts the cholesterol in our skin to the vitamin D. The other organs like parathyroid, thyroid gland, liver also take part into the vitamin D endocrine system. White Europeans make vitamin D easily because the sunlight really goes into their skin very quickly, whereas the brown and black, because of the melanin pigmentation, they do not have that efficiency. But then white skin has got the disadvantage that they have a lot of skin cancers. Maybe it's the creator's way of adjustment of benefits and issues. About 10 years ago, Institute of Medicine had increased the uh, RDA, that is recommended daily allowance of vitamin D, from about 400 to 600 international units for adults and 800 for elderly people. A lot of people think that is too low. Most recommendations are based on the bone health and not on other diseases which people are finding a greater correlation with, which we'll talk about. We all know that rickets and osteomalacia in later life, rickets in children that is strongly associated with having with the adequate level of vitamin D. The causal relationship uh, has been has not been proven, but the correlation benefit is mounting. Great. Double-blind randomized controlled trials have not happened. Many patients have low vitamin D in blood, but the question is raised is that is it the disease that is causing the vitamin D to be low, or is it the low level of vitamin D that is the cause? So we are sort of looking into it, and I'll give you one or two examples of how we are coming to finding it. It's a lot of people think that it is the lower vitamin D level which is causing the diseases. There is a vitamin D council. There is a scientist-led group which promotes the vitamin D deficiency awareness. They think that autism, autoimmune disease, chronic pain, diabetes, heart disease, high blood pressure, flu, neuromuscular disease, and there's a long list, breast cancer, colon cancer, prostate cancer, they are all related to lower vitamin D level. I got interested, and that is why I'm putting this video. This gentleman called David Davis, he's a member of parliament in UK. He did a adjournment debate, as they call it, in Parliament on 15th of January, and I got interested into it because this made a lot of sense. He mentioned about the studies of vitamin D in Andalusia, in Cordoba, in Spain, um, with the reference to COVID. These is very important and very very useful. Um, Cordoba study, I'll put some links also there. Um, they test they put they gave vitamin D to 76 admitted COVID patients. 50 of them out of 76 were given vitamin D, 26 were not given. And then the end result, out of 50, only one patient needed to go to ICU, whereas out of 26, 13 needed to go to um, ICU, and that is 50%. The other one is 2%. That means it is ICU need is reduced by 25 times. Another study where vitamin D is given to everyone, the death rate, daily death rate, was reduced from 50 to 70 to 10 to 15. High doses of vitamin D, of course. So that's death rate reduced by 1/2. That's a massive correlation. And on that basis, a lot of people are saying that if we had started giving vitamin D early last year, that is in about January, we could have saved a large number of lives. Dr. Fauci also takes the vitamin D supplement, as I understand. It has an epigenetically involved connection to immune system, innate and acquired both, and it also modulates inflammation, that is cytokine storm. Now the need is, it is not toxic, as I understand, not harmful, no downside, but still I think you need to talk to your doctor before you start the vitamin D and whatever the dose you start. There's 117 countries analysis has been done, and they find that because the UVB light, wherever it's lower, in the northern part of the globe and the southern part of the globe particularly, they have got a larger disease level as well as the mortality level because of the low vitamin D levels. Correlation is really very strong, and we need to commission, I suppose, a double-blind trial, which government are thinking to do it. Personally, I think there is no harm. I'm taking, by the way, I was taking until fairly recently 10,000 units every day, as against recommendation of only 800 units. Lately, I've been taking 5,000 units a day. A lot of people I know who have been taking 15,000 units for quite some time without any ill effect. The recommended blood levels are this: less than 20 nanogram per milliliter is deficiency, less than 12 is severe deficiency. Optimal level to be kept is about 30 to 50, which I'm keeping just over 30 to 40. Well, with all this, now what? We have survived almost a year, over a year in fact. Vaccine is here. Now we need some more patience for a few months. I think take rigorous precautions. Stay home if you can, only don't go out. If you have to go out, mask all the time. Don't meet strangers if possible. Keep your hands in the pocket. Don't touch anything. Wash hands very often. Observe 6 feet distance. And because there are lots of people who are asymptomatic and moving around in the society. And the last one is please get the vaccination as soon as you can. Lots of options available. Stay on it and make sure that you get the vaccine very quickly. Good luck, best wishes, and stay blessed.